Today, the medical community is reacting to President Trump's claims of a link between using acetaminophen or Tylenol during pregnancy and a rise in autism.
The president says the FDA will update labels on Tylenol and generic versions of the painkiller to reflect that possible link.
Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol, and don't give it to the baby after the baby is born.
The president's comments have generated plenty of discussion in the medical community. Ken View, the makers of Tylenol, issued a statement saying, quote, "Taking acetaminophen does not cause autism. We strongly disagree with any suggestion otherwise and are deeply concerned with the health risks this poses for expecting mothers." And the American College of Obstetricians and Gynecologists also saying, quote, "Suggestions that acetaminophen use in pregnancy causes autism is both highly concerning and also irresponsible when considering the message it sends to pregnant women."
And today, 10 TV's Bryn Caswell spoke to a doctor to discuss the Trump administration's claims and if there's any scientific evidence backing them. Here's that conversation.
So, Dr. Hussein, is there any tie between Tylenol usage during pregnancy and autism?
There is a recent study looking at older data implying a possible association with acetaminophen use and autism. But as we know, association does not mean causation. So just because two things are happening at the same time does not mean that A is causing B necessarily.
To your knowledge, are there any specific studies that have been completed that show Tylenol taken during pregnancy does not have a direct link to autism?
Yes. So in 2024, a study in JAMA, or the Journal for the American Medical Association, looked at 2 million children, and they controlled for confounders such as genetics and environmental factors. And they found no significant associations between acetaminophen use in pregnancy and the children's risk for autism, ADHD, or intellectual disability. And so these findings suggested that previously reported associations may be largely attributable to genetic factors within a family that was not accounted for rather than a causal relationship.
Now, I want to read this direct quote from President Trump back to you. He said this yesterday. "If you are pregnant, don't take Tylenol and don't give it to the baby after the baby is born." Again, that's a direct quote from President Trump. What is your reaction to hearing this again?
So this advice is not supported by science. Untreated fever can place both the mother at risk of preterm labor and the baby at risk of congenital heart defects, neural tube defects, oral clefts, and actually harm their brain development. And we have solid scientific evidence to back this up.
What options outside of acetaminophen do pregnant patients have when it comes to pain relief?
Unfortunately, not much. So we have our NSAIDs such as ibuprofen, naproxen, and full dose aspirin, which can actually cause problems late in pregnancy. So these medications can affect the baby's heart and kidneys. We have opioids, which can be used for severe pain, but those obviously come with risks for maternal dependence and the baby withdrawing. So acetaminophen is one of the safest over-the-counter pain medications that we have.
Patients who are pregnant, they're hearing all this mixed rhetoric. What advice do you have for them?
So as a parent myself, I definitely understand the fear and concern, and you want to do best by your little one. As always, I would speak to your physician and trust in their expertise.
Will you continue to tell your patients that Tylenol is safe for use while pregnant?
Yes, looking at all of the evidence reaffirm that acetaminophen is safe in pregnancy.